Good evening, everyone. My name is CJ, and I'm glad to be here with all of you tonight to discuss such an important topic. Welcome to tonight's webinar, Why Type 1 Diabetes Screening Matters, the Power of Knowing Early. So at Diabetes Sisters, our mission is to support and empower individuals living with all types of diabetes through education, resources, and community. And tonight's conversation is especially important because early detection of type 1 diabetes can have a profound effect on outcomes for individuals and their families. We're honored to be joined by our expert speaker, Dr. Victoria Buhari. Dr. Buhari is a board certified in endocrinology, diabetes, and metabolism, as well as in lifestyle medicine. She is the founder and CEO of Perry's Wellness and Diabetes Center and a proud board member of Diabetes Sisters. She's deeply committed to improving healthcare outcomes and advocating for population health initiatives. We're also joined by Jude Johnson, a licensed marriage and family therapist with over 2 decades of experience supporting individuals through trauma, anxiety, and stress. His integrative and compassionate approach helps clients gain clarity and emotional well-being, and we're grateful for his insights tonight. In addition to our speakers, we're so thankful to have three incredible women joining us to share their personal experiences with type 1 diabetes screening: Alejandra Marquez, Jamie Klein, and Tia Ware. Thank you all for being willing to share your stories with us. Before we get started, a few quick housekeeping items. You're welcome to use the Q&A box throughout the first half of the presentation. Our speakers will be happy to address your questions during the second half of the event. Once the presentation concludes, we'll transition into a breakout room for a live Q&A. This will give you the opportunity to speak directly with our speakers, ask questions, or share any concerns in a more personal setting. We're honored to be joined by our expert speaker, Dr. Victoria Buhari, who will now begin with a brief presentation to help us better understand the importance of early screening for type 1 diabetes. And now I'm going to turn it over to Dr. Buhari.
Thank you. Thank you for that very, very warm introduction. I'm very, very excited to talk about this subject. It's definitely one that is very, very important. So thank you for the introduction. And thank you again for those who have joined me today. All right. So today we're going to talk about type 1 diabetes and screening for type 1 diabetes. So let's go to the basics, which is what is type 1 diabetes? As we know, type 1 diabetes is an autoimmune disease in which you have the attack of what's called the beta cells. And these beta cells produce insulin. And the reason why this is important is because insulin is needed to regulate your blood sugars. Without insulin, the blood sugar levels can rise, and it can rise to a point where it can lead to serious complications. Besides the diagnosis of diabetes, it can lead to what's called diabetic ketoacidosis. And diabetic ketoacidosis is a life-threatening condition. So we know living with type 1 can be challenging. And the many reasons why this is the case, from the need to constant monitor your blood sugar levels, knowing the types of food to eat, knowing how much insulin to use based on what you're eating, forming a team support, a healthcare team that you trust, that you feel comfortable with, knowing what to do when you exercise, the cost of insulin, the cost of the complications and all the monitoring devices, as well as the emotional struggles. We know that there's something called diabetes distress. We know that there's higher risk and incidence of depression when it comes to diabetes. So we know that living with type 1 diabetes in itself can be a daily struggle. The risk of type 1 diabetes is based also on family history. We do know that if you have a family history of type 1 diabetes on both sides, mother and father, that portrays a higher risk of developing type 1 diabetes. And this stays the same for either a father or a mother with type 1 diabetes. It is important to note, however, that majority of people who are diagnosed with type 1 diabetes actually do not have a family history. And that's over 80% of people. So you can imagine this can come as a shock to people that are diagnosed with type 1 diabetes, especially when they're diagnosed with diabetic ketoacidosis. And unfortunately, about 40% of people who are diagnosed with type 1 diabetes presents with this life-threatening condition, diabetic ketoacidosis. So when it comes to the diagnosis of type 1 diabetes, it's no longer just one stage or one diagnosis when it comes to type 1 diabetes. We really look at different stages of it. So stage 1, 2, and 3 occur after you have the presence of at least two antibodies against the pancreas, against the beta cells that we spoke about earlier. So once you're found to have two antibodies and you have a diagnosis of type 1 diabetes, you are categorized into different stages. In stage 1 type 1 diabetes, you do not have any clinical signs of type 1 and your blood sugars are normal. In stage 2, your blood sugars are slightly elevated, so it's no longer normal, but it's not as high as you would see with the typical clinical symptoms and signs of type 1 diabetes. And then in stage 3, that's where you have the typical signs and symptoms as well as the blood sugars of type 1 diabetes. But it's important to realize that you can actually have type 1 diabetes, that's stage 1, years, months to years before you present at stage 3. And we do know that if you have stage 1 type 1 diabetes, the lifetime risk of developing stage 3 is 100%. The 5-year risk is at 45%. And then the 5-year risk at stage 2 is about 75%. So if you screen and you're able to identify if you have number 1 type 1 diabetes, but we can also tell if you have either stage 1, stage 2, or stage 3. So the reason why this is important is because we were really here to see if we can reduce complications. What we know is that diabetic ketoacidosis can be reduced if we screen early and we're able to detect type 1 diabetes. If you're screened and are found to be in the early stages of type 1 diabetes, research has seen that if you're a part of some type of monitoring program, your risk of developing diabetic ketoacidosis drops from that 40% that I spoke about earlier all the way down to 5%. So it can really reduce the risk of developing diabetic ketoacidosis if we screen and we're able to detect the early stages of type 1 diabetes early. We can also prevent hospitalizations. So if you screen and you're found to be in stage 1 or stage 2, then you're monitored closely and given the tools and resources that you're given tools and resources to prevent hospitalization. And you also can be prepared for the clinical stage of type 3 or stage 3 type 1 diabetes, be it whatever monitoring system you need. You have time to call your insurance and see if a pump or whatever continuous glucose monitoring technology you would like to use. You have time to prepare yourself. And then importantly, you have time to look at what resources are available in terms of treatment as well as clinical studies. So what does screening involve? And this is a blood test. We look for the presence of four, sometimes you'll hear five different antibodies. These four that I have listed here are the most commonly recommended antibodies when it comes to type 1 screening. It's a simple blood test, and this can be ordered by your primary care doctor, or you can go to a research institution and they can either give you a blood screening kit that can be delivered to your home, or you can go to laboratories such as LabCorp or Quest, etc. So these are the different ways in which you can be screened. The first two, which is Ask or TrialNet, these are research-based screening facilities. Both of them, you can have access to the screening tools sent to you, so that's mailed over to you, or you can go to a laboratory and get it done there. For these two, they screen not only for type 1 diabetes, but also another autoimmune condition called celiac disease. There are other state-based screening programs. So the states will sponsor the screening. So that's the Cascade and Pledge, Cascade in Washington State, and Pledge in South Dakota. And then finally, your primary care doctor can also order screening. Enable Biosciences is a screening kit that your primary care or your healthcare team can order, and that gets mailed directly to their office. And you can pick up the kit, do the screening at home, and mail it directly back to them. An order can also be sent over to LabCorp, Mayo, or Quest by your primary care facility. So what if you screen positive? A lot of things are taken into consideration in terms of what to do next. How many antibodies you screen positive for, not only the different types of antibodies, but within the antibodies, the quantity, as well as the different types. So whether it's the GAD antibody versus the other types of antibodies, all those things are taken into consideration. However, in general, when you screen positive, we definitely want to make sure that you get checked regularly. And I mentioned really gaining that understanding, the knowledge of the resources that are available to you, the knowledge of knowing what type 1 diabetes is. With screening and being able to be diagnosed with type 1 at an earlier stage, you really have time to digest not only the diagnosis, but to digest the information of type 1 diabetes and also the challenges and what to anticipate with the diagnosis of type 1. I mentioned the available treatments that are available, as well as being able to be prepared for potential emergencies. That's the diabetic ketoacidosis that I spoke about earlier. And of course, there are many, many research opportunities that are ongoing, be it TrialNet and other places that have ongoing trials, ongoing medications that you can decide if that's something that you want to participate in. The medication that is now has been FDA approved, and this was a huge deal within the type 1 community because for the first time, we have a medication called tezepelumab that can actually delay the onset of stage 3 type 1 diabetes. This is a medication that's given daily for 14 days and is given to anyone that's found to be in stage 2 type 1 diabetes who is older than 8. And again, it delays the onset of stage 3 type 1 diabetes by an additional 2 years. So you have 2 years free on average of not having stage 3 type 1 diabetes. And I'm going to turn it over to Jude.
Thank you, Dr. Bahari, and thank you all for having me. It's a pleasure to be here and the warm introduction. You know, facing the unknown is difficult. And anytime we're facing unknowns, the what ifs of type 1 diabetes, it's important to understand that fear is a natural part of being a human being. And we all get scared, and that fear that comes up is about the love and protection that you want to provide for yourself and your loved ones. And so, you or your family may be asking some difficult questions like, what if I test positive? How am I going to manage this? Or, gee whiz, my life is already so full of to-dos and stress that I can't even imagine how I'm going to like manage all of this. So it might just feel like you want to turn your face away from it and not really move towards it. But it's really important to screen because, as Dr. Bahari was saying, is that, DKA can be reduced from 40% to 5% with early detection. And, fear is saying, I should move away from this. And the testing, though, can balance out that fear with some knowledge. And if we have the knowledge that there is a problem and there are medications and lifestyle adjustments that can be made, that can reduce the negative consequences of avoidance significantly. So if we know ahead of time, there's less chance for a crisis and finding out that things are escalating and having to go to the emergency room or having, problems that can really be traumatic and scary for people facing diabetes. And so instead of asking, what is going to happen if we test, it might be helpful to ask a different question of what will happen if we don't test? And so we might be able to see some of those challenges that might come up by not testing. And so this can help you prepare medically and lifestyle wise, but it can also help you prepare for the emotional journey instead of it just having a sudden onset and a shock and surprise. Um, so learning to lean into these things is so helpful, and yet sometimes if we feel overwhelmed, we need to be able to find some balance with that. So one of the basic skills that you can use to reduce feelings of overwhelm and worry is grounding. It's called the 5-4-3-2-1 method. And that method is about the five senses, naming five things that you can see. So even the environment that you're in right now, you can look around and name five things, phone, computer screen, AirPods, uh, cup, sunglasses, right? So you have an idea what's in my environment right now. Um, Four things that you can touch in your environment and actually touch those things. Three things that you can hear. So sounds that are close by, further away. Two things that you can smell. One thing that you can taste. And you may find that just using one of your senses is the pathway that really helps ground you. It could be touch, it could be breath. You might grab an ice cube, you might run your hands under warm water, and all of those things bring you into the present moment. Which leads me to the next skill, which is a stop mindfulness skill. And mindfulness is being present in the moment, not judging it, and just trying to see things clearly. And this is a step-by-step process for being able to practice that can help regulate your nervous system out of that fear response or that fight response or that shutting down response. And the first step is to pause, to stop, to interrupt those train of thoughts that are going on, and to take some deep conscious breaths. And that will help send a message to your brain and your body that you're okay, even though you may be under some stress. It then allows you to begin to be observant of what am I thinking, what am I feeling, without being swept away by those thoughts and feelings. Observing can also be acknowledgement. You might even say to yourself, I'm having worried thoughts. I'm having thoughts about the future, thoughts about the past, whatever it is that's coming up, naming and acknowledging it helps dissipate the stress that you may be experiencing in the moment. When you go into a stress response because of fear or overwhelm, you actually shunt blood away from the frontal lobe. So it's hard to think clearly, which is why it's so important to slow down and pause and breathe. And you can just sit there and witness what you're feeling, what you're experiencing. And when you can regulate, then you can proceed by being present in the moment. Then you're empowered to actually make choices and decisions about what to do next when you're able to regulate your feelings. And we can reframe this, which is the next step here, is that we're shifting from what if this happens, what if that happens, to what can I do now when we're grounded. One of the analogies that I like to use with this stop mindfulness skill is that under stress, thoughts about the future, thoughts about the past, these are fight, flight, freeze responses. That it's like you've fallen into a rushing river and you can't get situated. But when you stop, when you pause, it's like you've gotten your head out of the water. You're orienting, or you're seeing where you're at, right? So that you can make wise choices. Taking those deep breaths regulates your nervous system, so you're like getting closer to the shore. And then when you can get out, you can see things more clearly. You're not swept away by all those thoughts and feelings. Then you can proceed with presence. And part of mindfulness is also compassion, compassion for yourself. So if you're feeling overwhelmed or if you're stressed, there's a tendency to be critical of yourself, to talk negatively. Oh, I should have thought of this already. What am I doing? And then we can go down into a spiral. So imagine that you're talking to a loved one or talking to a dear friend instead. And talking to yourself in that way can really help to reframe how you treat yourself and ground you in a more mindful approach. So in the next slide, if you don't mind, please. Um, so we go from fear to being empowered. It's important to remember you're not alone in this, right? There is support available through medical providers, through mental health care, counseling that can help you manage stress over being diagnosed with diabetes or having stress over loved ones who might be dealing with this. And it's also just a way of taking care of your well-being that can help reduce tension in your life, and community groups like Diabetes Sisters and others that can help inform you and keep you in the loop of how to take good care of yourself and your loved ones. Now, fear is, like I said, it's real, it's a natural human emotion, but it doesn't have to define your journey and where you're going. Screening is the knowledge. Uh, Choosing to screen is actually having compassion for yourself to figure out what is going on with my health. You're really becoming a full participant in this life that's important to you and your loved ones. And the more you face your fears and use the knowledge to help you, that helps build resilience. And I have a little quote here by Eleanor Roosevelt. She says, "You gain strength, courage, and confidence by every experience in which you really stop to look fear in the face." So that's all I have. We can open it up now to a break.
Jude, thank you so much for that. What Jude mentioned is extremely important. You don't imagine how many times we hear that fear components or somebody having this test kit and they just look at it for days, weeks, and months at a time. So thank you again, Jude, for that. What we really want to do is to empower you, is to give you the tools and the resources that are needed for you to be able to really take control of, number one, knowing if you do have type 1 diabetes, if there's any antibodies present. We offering a lot of resources at diabetessisters.org. So definitely stop by there and check out all the different things that are available. And you'll see it has from the why, the how, and the what when it comes to type 1 screening. There are multiple resources in terms of articles from the medication that I spoke about, why you should screen, understanding type 1 diabetes. We also have resources for your primary care or your healthcare provider, all the way from the labs that can be ordered, and what to do after you have been screened. So a lot of resources are available to you at diabetessisters.org.